Hello everyone, welcome to our new video today. So today what we are going to discuss is that how to manage COPD case. So I will just go through the management part, and the rest of the approach is similar to the one I taught in the basic SIMMAN approach. You can watch it in the channel, okay? Okay, so what are the main steps in case of the management? So it will include giving oxygen, giving nebulizers, giving steroids, and giving the antibiotics. Okay. So let's go through the first step, which is airway. So in this case, you will notice, if you noticed, that the oxygen saturation is low. Okay. So what will you do? You will give oxygen via venturi mask. So in case of COPD, what is the target oxygen that we want to achieve? It's 88 to 92%. Okay, that's very important to keep in the mind. Okay, and how to give the oxygen? So in this case of COPD, we will give oxygen by our venturi mask. A venturi mask looks like this, and this is the flow rate device. So we will start from 24%. So the blue one will come here. So it shows that the oxygen is given at a 24% and the flow rate will be 2 to 4 liter per minute. Okay, so you will start with blue one, and if when you go to the disability part and see still oxygen is low, we can change the blue with the white one. Okay, so in oxygen, if oxygen is low, we will give oxygen by venturi mask. Okay, so let's move ahead. And on the breathing part, when you do the palpation, inspection, percussion, and then when you auscultate, if you noticed there is wheeze, what will you do? You will change the venturi mask with the nebulizer mask. And then you will give salbutamol 5 mg given by air. So it's very important to keep in mind that in asthma, we give salbutamol by oxygen. But in the case of COPD, we will give salbutamol by air. And after, what will you order? The investigation, you will order chest X-ray and ABGs, arterial blood gases. That's it. Okay. Now let's move on to the circulation. When you go to the circulation, you will follow the basic approach of the circulation, like doing the inspection, examination, checking the skin color, etc., which you already know. And if you are not aware, you can watch the basic SIMMAN approach. And when you pass the IV cannula, you will give hydrocortisone, which is a steroid, which is IV 100 mg, and the rest is the similar. You will order the ECG and you will take the routine blood investigation, which is just the same. And on the disability part, if the patient is not improving, what can we do? You can increase the oxygen from 24 to 28% by changing the blue with the white one. Or alternatively, you can also try giving the ipratropium now. Okay, and after that, what will you do? You will do the inspection of the abdomen, private area, and the legs. Okay. And one more important thing, when you do the routine investigation, in this case, you have to send the blood for blood culture and for inflammatory markers as well. So after when you are done examination, all, you will hand over the patient to your seniors. What will you suggest? That we have to admit the patient, and what have you find on the record findings, and what interventions have you given? But the most important one is that you will review with your senior about the discussion of the antibiotics. So you will say, I would like to give the patient some antibiotics, which can be according to the trust guidelines, because every trust has different guidelines for giving the antibiotics. So just that's it. This is a very simple and basic approach, and this is the basic management. And in case you guys have any question, you can ask me in the group, or you can just write on in the comments. And one more thing, that shortly we are going to start our SIMMAN practice sessions, in which you guys can perform all the SIMMAN in 2-day class. I will post about regarding this in a group after discussing everything. Okay.